Today we'll be covering about ethical, legal, and confidentiality responsibility. This is topic number 4 from your syllabus. So, first of all, let's talk about all the ethical considerations or ethical responsibilities whenever we are talking about system approach or transcription. So, basically, whenever we talk about patient trust, so ethics, it can act as a compass of medical transcription. What I mean by it is, we can imagine, like, for example, there is a medical transcriptionist. He can act as a guardian who is guarding any vault which is filled with patient's most sensitive health information. This information, which is kept safely, it can include details about a patient, medical history, diagnosis, medication, and even their personal struggles or personal details. So that is why it is very important to uphold confidentiality for these medical transcription and to maintain the ethics. Now, talking about one example, like a medical transcriptionist, if he receives a dictation from a doctor detailing a patient's recent cancer diagnosis. So the transcriptionist, he has to ensure that this information is only included in the official medical report and it is not discussed with anyone outside the authorized health team. So coming next is accuracy. Because with accuracy, we can ensure that every word, whatever is transcribed, it leads to the right treatment. So a medical record that can be considered as a blueprint for a patient's health journey. Every detail which is mentioned in this blueprint, it plays a crucial role in directing the course of treatment. Medical transcriptionists, they have a fundamental responsibility that they transcribe dictation with integrity and in an accurate manner. So what we mean by this is that they need to be faithful in capturing every word which is spoken by the healthcare provider, and they ensure that no information is omitted. Now, if we considered a example for this, just give me a second, just a second. Yeah. So if we consider example, so for like say a doctor who dictates a patient's medical dosage, and in that he mentioned that 10 mg twice daily. So the transcriptionist, he has to be very careful while verifying the dosage, because it, like any misinterpretation in, like, whether the quantity or the frequency of dosage can lead to incorrect medical administration, and which can actually affect health of the patient. Now, after accuracy is professionalism. Professionalism, basically, it helps in building bridges for seamless collaborations. When we talk about professionalism in medical transcription, it extends beyond just certain technical skills. It also is about fostering trust and collaboration with the healthcare team. It includes certain aspects like respectful communication, in which transcriptionists treat everyone they interact with, from doctors to colleagues, with courtesy and respect. Second is adherence to protocol. In this, they meticulously follow established guidelines and procedures to ensure consistency and accuracy. After that, the third point is prioritizing patient care. So in this, every action should be driven by the ultimate goal, which is to provide the best possible care to the patient. Now, let's consider an example where a medical transcriptionist, he receives a dictation with unclear terminology. In this case, he could politely reach out to doctor for clarification, and it is his responsibility to ensure that final report is clear and unambiguous for all healthcare providers involved in the patient care. Now, coming to continuous learning. Well, it helps in adapting to ever-evolving landscape of medicine. So, we already like discussed this yesterday also. The medical field is a dynamic environment which is constantly undergoing advancement. So, when we want to stay on the top of the game, medical transcriptionists, they should embrace continuous learning. This includes certain steps like, first of all, expanding medical knowledge. In this case, they need to look out for actively look out for certain opportunities to deepen their understanding about upcoming medical terminologies, procedures, and different medical specialties. They need to be staying current with the technology. So they have to explore and adapt to new technologies that can enhance their efficiency and accuracy. So they need to be up to date for all speech recognition softwares and whatever built-in medical dictionaries are available in that. Considering an example, for example, a medical transcriptionist, he attends a workshop focusing on the latest advancement in oncology terminologies. So this will allow them to accurately transcribe reports which are related to cancer diagnosis and treatment. So we can say that by embodying these core ethical principles and remaining dedicated to continuous learning, medical transcriptionists actually they can play a very critical vital role for safeguarding patient privacy. They can also ensure treatment accuracy and by following all these perspectives, they can actually help in collaboration with healthcare team. And ultimately, all these features and following all these, they can contribute in improved patient outcome. So after ethical, let's come to legal guardians. Medical transcriptionists, they can act as legal guardians of patient data because they have certain responsibility in medical transcription. So generally, medical transcriptionists, they work behind the scenes, but their role is crucial in upholding the legal framework of healthcare system. As we have discussed yesterday that medical transcript record, they can also act as medico-legal documents. So that is why the responsibility of medical transcriptionist increase in maintenance of these documents. We'll discuss about what are the legal responsibilities of medical transcriptionist and how they impact the patient care. So first one is HIPAA, which is the Health Insurance Portability and Accountability Act. So it is a shield for patient privacy. Imagine a patient is there entrusting their most sensitive information to the healthcare system. So this HIPAA, this basically act as a legal shield in which the information of patient is protected. Medical transcriptionists are legally obliged to comply with all HIPAA regulations. Let's consider an example in which a transcriptionist receives a dictation detailing a celebrity recent surgery. So we all know, like when there is a case of celebrity, there is an involvement of many people, like media is there, and like many fan following is there. They really want to know about the exact situation of the celebrity. So in this case, the HIPAA mandates that they treat this information with the same level of confidentiality as any other patient data. So in this kind of sensitive information from celebrities, it has to be taken care of, and no unauthorized disclosure should be done, because it could result in hefty fines and even jails in some cases. Now, second is data securities. So, data transcriptionists, they can act as guardians against breaches. So let's think of a medical transcriptionist as a digital security guard. In this particular case, they are protecting a vault which is filled with patient data. They are legally responsible for implementing appropriate security measures to safeguard the information. Now, certain other aspects involved in this are encryption. So, this in encryption, what happens? Basically, the patient data is scrambled, making it unreadable to unauthorized individual who might interrupt it. Second is to have control to access. In this case, only authorized people, they have access to patient information, and transcriptionists must ensure proper login credentials and restricted access levels. Coming to secure transmission protocols, so data, whenever it is transferred, it needs to be transferred in a very secure way between systems. Encryption and social secure file transfers protocol ensure that this information doesn't fall into wrong hands. Coming to next point is medical records. While we are documenting, we have to follow certain level of accuracy and standards. So, medical records are legal documents of patient's health journey. In case of legal defensibility, and to ensure that accurate treatment decisions are taken, medical transcriptionists, they should adhere to established documentation standards. Now, let's take an example in which a doctor dictates a patient's medication dosage as 10 mg twice daily. Following established formatting conventions, this will ensure that this critical piece of information is clear and also unambiguous in the medical records. Any kind of deviation from these standards could lead to misinterpretation and also to certain potential legal issues. If like for example, there are any adverse reactions to the medication. Now, coming to next point is informed consent, in which we are respecting patients' autonomy. So, the whole information is about these patients. So they have a right to know like how their health information is being used by multiple stakeholders. Uh, it is very important to respect their informed consent, as it is required in both cases of legal and ethical, and medical transcriptionists, they have an obligation to adhere to these informed consents. Let's consider an example in which a research team is there which requests access to anonymized patients' data for a medical study. So in this case, the transcriptionist, they should ensure that proper anonymization procedures are followed. And on top of it, it is very important, like all the patients who are included in the studies, they have consented to their data that is being used for research purposes before releasing any kind of information. By fulfilling these legal responsibilities, medical transcriptionists, they play an important role. for some important things like, first of all, they help in protecting patient privacy and building a trust. Next is they ensure that accuracy and integrity of medical record is maintained. One of the other important feature is mitigating legal risk for healthcare provider. And last is respecting patient autonomy and also control over their health information. So, medical transcriptionists, when they commit to these legal safeguard forms the foundation for a secure and legal healthcare system. Now, coming to confidentiality. The third point is confidentiality. So, basically, medical transcriptionists, they are shielding patient privacy. And how they are helping in this? Basically, when we talk about confidentiality, it is the bedrock of trust in the healthcare system, where medical transcriptionists, they actually act as guardians of this trust, and they safeguard a patient's most sensitive information. Let's take a deeper look into what are the key strategies that are employed to ensure confidentiality. First is building fortress with access control. So let's imagine a patient's medical data as a fortified castle. So in this case, the access control measures are the strong walls, and they are guided by gates which are protecting this castle. Now, transcriptionists, they basically use secure login credentials with complex passwords to act as the key masters. In addition to these, they also, various access levels are also restricted. And this helps to ensure that only authorized people who have like appropriate and prior clearance can access specific patient information. Let's consider an example in which a transcriptionist receives a dictation about a patient with contagious disease. In this case, to have the access control, it ensures that only healthcare provider, they directly involved in the patient care, they can have full medical report. There are multiple support staff and staff from other departments, but they should be granted access in limited to certain limited information, which can be like appointment details, and the confidentiality of the diagnosis should not be compromised. Now, second is secure transmission. In previous classes, we discussed about like how the data is transferred from one software to another software, and sometimes it is also encrypted. So in this case, just this is. So in this case, think of securely transmitted patient data as sealed royal message, which travels between castles. Okay, so why I am giving this example? Because patient sensitive information is as important or as critical as there were messages between two nations or sometimes royal messages. So they have to be considered with that much of sensitivity. So transcriptionists, they utilize secure transmission methods like encrypted email or secure file transfer protocols. This basically like they are acting as royal messengers. So what happens? These protocols, they ensure that message, which is in this case is patient information, it remains confidential during its journey, preventing anyone from intercepting or reading it. Now let's take an example in which a transcriptionist he needs to send some completed medical report to a specialist for review of patient health concerns. What they can do in this case, they should use a secure file transfer protocol, and also the data should be encrypted, making it unreadable to anyone who might intercept it during transmission. This whole process, it will ensure the specialist receive the information, confidentiality, and security. Now, coming to data encryption, this is one of the important part of this whole confidentiality matter. So, let's imagine data encryptions as an unbreakable vault within the castle, so that it can provide an extra layer of security for the most sensitive information. Transcriptionists, they utilize encryption technique to transform patient data into an unreadable code. It actually helps to make it inaccessible to anyone without the decryption key. And if we consider example, we can say like a dictation reveals a patient's HIV status. As we know, when there is a patient with certain critical status like HIV, it is very important to maintain the confidentiality. So the in this HIV status case, the transcriptionist would encrypt this information within the medical report. This will help to ensure that this information which is encrypted, it should remain confidential even if someone gains unauthorized access to the report itself. Now coming to data encryption is important, but somehow we can say a promise or for maintaining the confidentiality or a kind of like honesty or oath is very important by the transcriptionist. So think of confidentiality agreement as a solemn oath taken by a knight, because pledging loyalty and secrecy. So, by signing such agreements, which medical transcriptionists do, which are also known as NDAs, which is non-disclosure agreements. So, in this case, medical transcripts, they formally commit to maintain patient's confidentiality. These agreements outline specific obligations and responsibility in which how they are going to handle and disclose patient information. Let's consider an example in which a transcriptionist, he receives a lucrative offer to sell some anonymized patient data for marketing purposes. So, the confidentiality agreement which they have signed, it reminds them that such kind of actions are violation of patient privacy, and these could lead to legal repercussions. So, by diligently upholding these principles of confidentiality, medical transcriptionists, they play a vital role in building trust with patients and ensuring how they feel comfortable disclosing sensitive information. Also, it helps in protecting patient privacy and preventing any unauthorized access to the health data. It also helps in complying with legal and regulatory requirements like HIPAA. This also facilitates for commitment of medical transcriptionists to confidentiality, and it also forms the foundation for a secure and ethical healthcare system where patients can feel confident that their information is safeguarded. So this covers your this topic, ethical and legal responsibility and confidentiality. Priyanka, any question or any doubt till now?
So I'm almost.
Okay. So, okay, good. So I will be coming to preparation of miscellaneous medical reports. Okay, this is like your fifth topic.
Chapter 4. Yeah.
Fine. Okay. Okay. Can you see the screen?
Yes, ma'am.
Okay, just give me a second. Just let me have some water.
Okay.
Okay, now we have in like past few days we discussed about how medical transcription can be done, why medical reports are important, okay, what role they play in patient safety and privacy. Now, after that, we will come to how these miscellaneous medical reports they are prepared. So, we have discussed this. Like a medical report, it basically provides a detailed account of patient medical history, the current condition, and also the treatment plan. And also medical reports, they can be written by various health professionals, which can include doctors, nurses, therapists, who are the caregiver to the patient or providing services to patient. These reports basically, they help them to track the patient progress, also making informed decision about treatment and communicate with each other. Medical transcription service, basically it ensure that this information is recorded and transcribed accurately and is easily accessible to all healthcare professionals who all are involved in patient care. Now, coming to accurate medical records, these are essential because they help in providing high quality patient care as they contain certain important information about patients, certain patients information, which includes any medical history, diagnosis, treatment, and also progress. So medical transcription reports, they come in various types, like and they each of them serves a specific purpose. These reports, they serve as a crucial part of the patient medical record. So it is always important to ensure that accurate and complete medical records are maintained. They facilitate communication between healthcare professionals and reduce errors and improve the overall efficiency of healthcare system. Now coming to what all steps are followed in preparation of miscellaneous medical reports. So as per the steps mentioned in your syllabus, I have jotted down this graph in which you can see that in step 1, there is collection and receipt of dictation. Basically, in this point, there is receiving of dictations, and after that, there is verification of source and clarity. Once information is received, then transcription process happens, which is followed by, first of all, transcribing dictations. Then accuracy check is done. And after that comes the editing process. Once we have a draft document, review and quality assurance is done, which includes proofreading, consistency, check, completeness, verification. After that, when QA is done, there is another step which includes compliance and confidentiality, which includes HIPAA compliance, data security measures, and after that, all the confidentiality protocols, they have to be followed. Once we have a verified document, so what happened after that? Distribution and utilization, in which there is an integration into EHR, communication with healthcare providers, patient education, and legal documentation. Okay. Yeah. Can you see the screen? This PDF document.
Yes, ma'am. Preparation of miscellaneous medical report. That's it, ma'am. From PDF.
Yeah. Okay. Just a second.
It, ma'am.
Just a second. Huh?
Yeah, yeah.
This part actually I covered, and yeah, just a second. Yeah. So I gave you a brief intro about how to prepare different type of medical transcription and also steps which are involved. Now we'll be discussing these steps in detail. So
Yeah, ma'am.
whenever we are preparing miscellaneous medical report, sometime some like foremost is important. Step one is like different type of medical transcription reports are done. So as we have already discussed that medical transcription reports, they provide a comprehensive record of patient care. They help to track a patient progress and identify any kind of issues or concerns, and also ensure that patient receive the best possible care. So these reports they use for medical legal practices, for defending against any medical malpractices, or for entering into any kind of lawsuits. So some different type of medical transcript report which should be prepared are physical and history report. So in this case, whenever a patient is admitted by a doctor or a resident, they typically order for this kind of report. This is, you can say, it is known as the history, because in this case, a past medical history, social history, family medical history, and history of current sickness is recorded in this system. System also reviews and thorough physical examination from head to toe are typical. And this physical and history report also, it actually concludes with the patient's treatment plan and admission diagnosis. After that, there is a consultation report. It is basically whenever a admitting doctor, they refer to a consultant specific, and this consultant basically write this report. In this, the consulting physician basically they have a different area of expertise than the admitting physician. And in this second level of opinion, um, the typical description of patient disease and specific physical examination is included. In this report, basically, it concludes with a consulting doctor assessment and treatment recommendation. Because and also this report might contain certain laboratory investigations, or certain other X-ray results or MRI results. It might contain them. And also it also includes like treatment recommendation, and sometimes it has a specific statement in which the consulting doctor they might express gratitude to the referring doctor for referral. Now, next, another kind of report is operative report. In this report, this is dictated by the physician who operates the patient. This is very critical as it includes specific details about an operation, and what was the procedure which was followed for operation. It also has like pre-operative and post-operative diagnosis, and actually what kind of surgery or multiple surgeries were performed. It also includes like the staff basically, which includes the surgeon or attending nurse staff, and like who gave the kind of anesthesia which was providing. So, and also a thorough description of surgical process which was conducted. It is included in this report. Now, so this report will frequently conclude with disposition, the location to which patient was taken, and now when he leave the operating room, typically to the recovery room, and patient state at time of transferring from the operative room. After that, there are certain other reports like radiology report, which includes X-rays, CT scans, MRI scans, nuclear medical treatments, and also fluoroscopic examination. These are like some typical examples of radiology report. Pathology report, in this, microscopic and pathological diagnosis reports are included. This is a document which is approved or written by a pathologist, and they summarize the result of diagnosis, tissue diagnosis. Then there are laboratory reports, which are result of tests done on fluids like blood or urine. But as such, these reports, laboratory reports, they are part of the main investigation or main patient history report, rather than rather than some separate reports. But they are frequently part of any consultation and discharge summary. Along with that, sometimes there are certain miscellaneous reports, like if there is any electrophysiological tests are done, certain hospital procedure like autopsies have done, or like if certain psychiatric evaluation are done for the patient. Okay. Coming to next step, understanding the role of medical transcriptionist. So basically, I think I have covered a lot of on this in last few days. Okay, so I don't think we need to go deeper into this topic. We all know like what is the role of medical transcription. So basically, transcribing dictations, which we have been discussing about it, that these include medical reports, discharge summaries, consultation reports, progress reports, okay, and diagnostic report. Coming to, we have already discussed that any medical transcriptionist, they should ensure accuracy and clarity, and then adhering to formatting guidelines. Then, so this is step 2. I am not going in very detail because we have already discussed it day before yesterday. Okay, directly coming to step 3, in which preparation of miscellaneous medical report, how these go. So in this case also, we have like gone through it. I will just touch upon some important point in this step. So basically, first of all is collection and receipt of dictation. So in this, what happens? While receiving the dictation, the process, it begins with receiving of audio recordings or voice files of dictation from healthcare providers. In this case, basically dictations are typically received electronically via certain secure channels or through transcripting software. Okay. Now verifying the source. So upon receiving dictation, what transcriptionists do? They verify the source of recording so that they can ensure that from where, whether it is originated from an authorized healthcare provider or not. Now coming to exactly what happens in transcription process. So this also we have discussed in great detail. Like first of all, the transcription of dictation is done. By listening to each dictation, they accurately capture all information provided by the healthcare provider. And after that, there is a accuracy check that all the text is thoroughly reviewed to verify the accuracy of medical terminologies, whatever diagnoses are done or medication prescribed and treatment plans. So in this case, transcriptionists, they may cross-reference the transcribed test with the audio recordings. So they can like ensure that everything is like accurate and it is done in a precise, accurate manner. After that, there is editing, in which, of course, they do it for clarity, coherence, and grammar. They have to, transcriptionists, they have to adhere to certain formatting guidelines, which are specified for each kind of medical report, because it helps in readability and professional presentation of the report. Now, coming to review and quality assurance. So, three steps are done: proofreading, consistency check, and complete verification. We have gone through it yesterday. Like in proofreading, any spelling errors, grammatical mistakes, and typographic errors are taken care of. And if we talk about like consistency check, so it helps in maintaining consistency in terminology, formatting, and styles. Like a same style of report is maintained throughout the report. Coming to completeness of verification. So each report is verified so that it can be ensured that all relevant information provided in the dictation is accurately transcribed. Uh, Now, coming to compliance and confidentiality, we have been talking about this. First and foremost, regulatory law in case of compliance for medical transcription is HIPAA, which is Health Insurance Portability and Accountability Act, uh, as it always helps in maintaining patient confidentiality and privacy. So, all the transcriptionists, they have to take care of compliance for this act. Then data security can be maintained. We have discussed there are certain steps like how unauthorized access can be maintained, how disclosure or non-disclosure statement they can be signed, and how these breaches can be prevented. Then how encryption technique can be employed to transmit and store sensitive data. Next is confidentiality protocol. In this, personally identify information is basically removed under the Human Subject Protection Act, or they de-identify the reports to maintain patient's confidentiality. And access to this patient data and medical record is restricted to authorized people also. And this also helps in maintaining the confidentiality and just a second. Yeah. So this also helps in adherence to compliance with privacy. Now, coming to after that comes the step of distribution and utilization. So in this, there is a integration into EHR, where all the transcribed medical reports are integrated into electronic health records, which are known as EHR, so that we can have a comprehensive repository of patient information. EHRs, they basically help in facilitating access to patient histories, to take care of treatment plans and diagnostic findings by healthcare provider. The next in distribution and utilization is communication with healthcare provider. So in this case, all the transcribed reports, they are shared with healthcare providers to facilitate communication and collaboration in patient care. These might include physician, nurses, specialists, and other members of healthcare team which can rely on these reports. One of the important part which we have not discussed till now is patient education. Okay. Just a second. Yeah, this is an important part. So, the information is about patient. So it is very important that they should understand their own medical condition. So patient, they should also receive transcribed medical reports so that they can understand what kind of medical condition they are going through, what are the treatment options available for them, and by following any or selecting any kind of like option, how it is going to impact their health in future. So like for example in oncology diagnosis, so there are certain protocols there and patients have a choice. So it is very important that the transcribed document they are able to understand it so they can choose the best option available for them. Okay. Then there is legal documentation. As these transcribed medical records, they also act as legal documentation whenever we talk about any malpractices or insurance claims, or certain times there are disability determination and other legal proceedings. So these reports they are considered official records of patients. Okay, and they are used in any legal disputes or regulatory investigation. So, coming to an end to this, this step, we can say like following these steps, healthcare organizations they can basically ensure that accurate preparation and utilization of miscellaneous medical reports they help in decision making. Next step, step number 4 is consideration for accuracy and compliance in medical transcription. So, this also I have discussed yesterday. So, I will just touch upon main point on this. We'll not have a deep dive into this. First one is medical terminology. We discussed yesterday that the medical transcriptionist they should have a understanding of medical terminologies because there are multiple departments: anatomy, physiology, pathology. So it helps them to understand. Next is continuous learning. They have to update themselves because medical field it is a daily new advancement, new diseases, new healthcares are coming. The whole science, medical science is you can say evolving day by day. So they have to be on medical transcriptionists they have to be on toes for any kind of like digital software. They have to undergo any kind of trainings to keep them up to dated so they knew all medical terminologies, procedures which they can use, and they can jot down the information in accurate manner. Next is reference material. So there are many medical dictionaries, or also nowadays there are many online resources. So the medical transcriptionists they have to understand how to refer to these material. Then yesterday we already covered this point number 2, in which we talk about medical transcriptionists. They have to give attention to precision and accuracy. They have to verify information and also double checking. This is very important. Although double checking is a standard practice in medical transcription because it helps to ensure completeness and accuracy, but transcriptionists they have to review their work multiple times before they finalize and submit any transcript reports so that the errors which are there they can be minimized, and also the quality standards they can be maintained. When we talk about precision and accuracy, transcriptionists they have to pay meticulous attention into detail. So they ensure that every word and detail is accurately captured. Coming to adherence to guidelines, so there are certain formatting standards which are followed. Okay, so transcriptionist, they have to for each kind of medical report, they have to ensure that there is a consistency and uniformity. These guidelines, they specify what kind of a structure, layout, or organization of the report is. It has to be followed, and actually it helps the organization to for them to read and understand these documents. Coming to documentation requirement, so certain guidelines are required, which includes what are the demographics of patient, about the medical history, physical examination findings, and diagnosis and treatment plans. So, along with that, there are certain regulatory compliance which we have discussed, like HIPAA is there, and also they should have this oath and NDA document they have to follow, so that security regulations are there, which actually help in protecting patient confidentiality and ensure that secure handling of medical records and sensitive information is done. So I think we can close on adherence to guidelines, and tomorrow we can discuss from quality assurance. Is it okay?